IMT here with the Providence Holy Cross Hour, where once a month we bring various medical topics to you from Providence Holy Cross. And today we're speaking with Dr. Bob Raji, who's from the senior leadership team. This gentleman is the chief medical officer, and we're going to learn a little bit more about what that is. Dr. Raji, thank you for being here today.
Thank you, T. Pleasure.
So tell me a little bit about you. I'd love to know your medical credentials, title, role. Give me your curriculum vitae.
I went to Georgetown Medical School, and then I did my residency in anesthesia training in St. Vincent's Hospital in New York City. I did a pain fellowship in University of Virginia, and then I eventually became the chairman of anesthesia, and at the same time I became the chief medical officer of the hospital, working with a Cornell affiliate and previously at Stony Brook University in New York.
Now, I have to believe for a lot of patients, I think one of the things that are most painful is the idea of pain, and the idea that you come with a background of knowing that fear and what patients are looking most to alleviate. I think that's wonderful, not just from a physical aspect, but I'm sure from an emotional and psychological aspect. So you have sort of the snow globe view of the hospital over at Providence Holy Cross. And what is your exact role there at Providence?
Well, let me just go back to pain for a minute. I was reading last week about patient satisfaction is very closely joined with pain control in a hospital, and that's something that the hospital focuses on very closely. We are a magnet hospital with magnet nurses. Our nurses are extra qualified and involved with the governance of the hospital, and many of the patients and the physicians go there because of the terrific care they get from the nursing there. I'm a firm believer in preemptive pain, so that if you can stop the pain before it starts, the long-range chronic pain will be less in the end.
I think that's wonderful, because truly in every possible aspect of medicine, no matter who comes to your hospital for what it is, that is one of the things I think we're all so afraid of. And your nursing staff, absolutely, you have one of the best. They are on top of it. They are informed, an incredible group. So as chief medical officer, you are working primarily with the nursing staff, with really, again, snow globe view of everything.
Well, I see the role of the chief medical officer as the fulcrum liaison between the medical staff, the administration, and the rest of the hospital. A lot of ancillary services make up a hospital: environmental services, dietary, nursing, laboratory, and pharmacy. So I basically feel myself as a liaison from the physicians to every other aspect of the hospital. The main thing that a chief medical officer in a hospital, as you know, some medical corporations have CMOs, but in a hospital, the main focus that they have is on quality. And it's like the movie Field of Dreams: if you build it, they will come. So if you have quality patient care and patient satisfaction and good medical evidence-based medicine with good outcomes, the patients will follow, and the word will get out. So there's two departments that directly report to me, and one is the quality department. And we basically look at different quality issues that we try to improve on a continuous basis in the hospital. We try to focus on decreasing and eliminating any hospital-acquired infection that the patients get with infection from a central intravenous line or a urinary catheter. We look at the infections that they get when they come from a nursing home. There are something called C. difficile, which is a tremendous plague across the country, costing the general budget of the United States government a tremendous amount of money. So quality is the one aspect that we do. The other department that reports to me is the credentials department, which basically reviews the credentials of physicians applying for activity in the hospital, and we have to do an opinion whether they are qualified, whether they have the right training, whether there's any skeletons in their background, or any issues. credentials. We, again, continuously improve the quality of the physicians, try to educate them with CMEs and various topics.
You're the guy with the fine-tooth comb going through, making sure that all the boxes are checked or unchecked. It sounds like.
Well, I'll give a shout out to the medical staff office. They do all that, and we look at their reports at the end.
Now, you talked about the idea of you mentioned the infections where patients will come in with something. Can you talk to me a little bit about that? Because you mentioned that it's costing a lot of money. Tell me a little bit more about that.
Well, I've been into Netflix lately, and I've been watching all the reruns of the House series. And there's a very good rerun, I'll send you the link, about what he discusses about antibiotics. Antibiotics are given out too liberally in this country. So basically what's happening is all the little microbugs are becoming resistant to one antibiotic after another. So if it's a virus, the antibiotic isn't going to do anything, yet people go into a physician's office with a cold, with the sniffles, rhinitis, and they get an antibiotic for something that an antibiotic isn't needed for.
No.
So this has led to a tremendous amount of mutation by the bacterial colonies, and this country is facing a crisis of this magnitude. And there has been a White House symposium recently on this issue. So we have an antimicrobial stewardess campaign in the hospital. We have an infectious disease pharmacist. We have the pharmacy. We have a infectious disease specialty physician champion who focus on it. So we review every antibiotic that is given in the hospital, and we try to tailor it to the bug that we're fighting. So we're very focused on that because it's very important.
It's amazing that we've come to this point, because this is a conversation that has been happening for some time, that antibiotics have been given too freely. So is there something in place to sort of police that, watch that? Is that just at a physician's discretion? Do you know?
Well, it basically is a national progress, and it's going to get more and more attention. And every hospital, medical system is involved with this. We internally do our part of this, and we have an excellent team. I met with them yesterday, very proud of them. And we have communication with the doctors saying, you're on this medication, you might want to try this one, and this is what the bug tells us what medication to go.
And hopefully patients will become more aware of this and ask questions of themselves, whether or not that's something, because a lot of times doctors get bullied. I've seen patients walk in and say, no, I want this, I know I need this, it's worked before, and I feel badly for you guys. But as the more patients who understand, I really should be questioning, and if my doctor tells me no, I should not be, forcing his hand.
It's a matter of culture and education to the patients. I heard an anecdote yesterday that if a patient goes to a doctor's office in the Netherlands, he's disappointed if he gets an antibiotic. And they're aware and they're knowledgeable in the Netherlands, whereas we have the complete opposite here.
Interesting. You're up against a lot, and that is just one of the many, many topics. Can you tell me a little bit about, I know various initiatives taking place at Providence Holy Cross for the improvement and enhancement of patient care. You tell me a little bit more about, I think it was patient satisfaction initiatives. You talked about pain being one of those issues.
Well, I can tell you that I was on the East Coast and I traveled to the West Coast to get this job. I think it's Providence Holy Cross, a tremendous hospital, tremendous team. I worked in a lot of hospitals, Catholic-based, Christian-based before, but they walk the walk and they talk the talk. So
excellent.
We have a lot of initiatives. The pain initiative we're looking at, we have a alliance with the City of Hope in our cancer treatment, and we are looking to improve pain control for the patients. Some of the other ideas that we have or initiatives. We have a terrific stroke center, a credentialed, classified stroke center, and basically we look at the door to intervention time, the door to needle time.
Because that's critical. Time is of the essence when it comes to stroke.
When you have a stroke that's caused by a clot, every second is important, and their brain cells dying. So the quicker you get the clot buster drug in the veins, the quicker the patient has a good chance of survival. We have something interesting now. We have telestroke. So there's a lot of talk about telemedicine in the future of modern medicine, but what we have here...
as in tele...
A television or a computer monitor, so that the doctor needs to see the patient within 15 minutes of arrival into the emergency room. So the physician can get on his laptop, get on his iPad, and actually look at the patient, look at the pupils, look at the face droop or the lip droop or the facial expression, look at the physical exam with the ER doctor, and they can make a decision whether this patient may be a candidate for the clot buster drug.
We've come to the point in history where there's an app for that. That's incredible. So you FaceTime your patient basically, but that is something, because it is a visual examination, and it's something that can be done and be helpful. Oh, that just gives me goosebumps. That it's a good time to be alive.
It really is, and I don't know any other way that you're going to get a doctor in there 15 minutes, and we're set up to do it.
But the fact that technology can help you is really remarkable.
Right.
One more reason to love Providence Holy Cross right there. So in addition to the stroke center...
We have a terrific trauma center, very, very active. It's nice to know that the trauma center is... down the block. It's a level 2 trauma center. We have all the services available. We have a helicopter pad, and it's very, very robust. We have all the ancillary subspecialties that are needed: plastic surgery, orthopedics, general surgery, every subspecialty if a patient has a trauma, car accident, motorcycle accident. We had a hiker who was flown in, with some injuries. So the trauma center is very active and very successful. We also have our cardiology center, and we are doing tremendous amount of work in interventional cardiology, placing the stents in. And this is another change in medicine that, 20 years ago, instead of having open bypass surgery,
now it's vascular.
Now we're doing stents, and we're saving the surgery for the ones who really would benefit from them.
Would it be too much to ask that Providence Holy Cross is the model for every other hospital in America?
Well, we've received the Health Grades Service Excellence Award for 3 years, and I'm going to let the quality and the spirit and of the magnet nurses and speak for Providence.
It's really an incredible facility. Now, with all of the wonderful aspects of Providence Holy Cross, with everything that you have going for you, do you find you have any unique challenges for physicians and you as the Chief Medical Officer since the implementation of the Affordable Care Act, Obamacare?
There's a tremendous shift in medicine in America today, and Obamacare certainly jump-started that change. And it's good, but it's a lot of challenges. So we have patients who never had insurance before who have Obamacare insurance. It's Medi-Cal. Medi-Cal is broken down different HMOs. So these patients wouldn't think about going into an ER, but now our ER is basic for 80,000 patients a year. We're shooting for 350, 400,000. So our ER is very successful. Our door to see the doctor time is very very quick, and we do see a lot more patients, and probably a big part of it is the Obamacare.
I have to tell you a quick personal story. I had an issue where I aspirated some food a number of months ago, and I went into Providence, and I was never not seen the whole entire time that I was there. And I've never had a hospital experience like the one at Providence, because if it wasn't your admin, and then it was a nurse, and then it was a respiratory person, and then it was this person, and then it was a quality care, I've I've never, first of all, never felt so loved even at a family reunion where so many people were coming up and making sure that I was okay. It is incredible. Door to door to doctor time, and then from doctor time to being let out. It was a very well run, and I don't really want to say the word machine because I think that doesn't do you service. I think it was a very beautifully orchestrated circumstance that from beginning to end, you guys are on top of your game.
They're very skilled professionals, from the clerks to the nurses to the physicians to everyone else, techs helping them. And if you look at the challenge of seeing such a large amount of patients, you have to do the triage first. Which ones need immediately treatment, like the stroke patients, person having a heart attack, or some other urgent bleeding problem. And it really is a fantastic job.
And the numbers increased. Tell me that again, because math fricassees my brain. The numbers increased from 80?
Well, 80,000 a year to 350,000
since the Obamacare initiative.
Right.
Wow!
Right, so it's amazing.
That's unbelievable, those numbers. And then for you guys, just how daunting that must have been in the very beginning when you realized the tsunami, just the avalanche of people who were coming in.
Right.
Do you find it makes you? Certainly, it makes you better. But does it present a whole new, besides just the volume of people? Are there new challenges that you didn't see when you first prepared for it?
It keeps you on your game, keeps you on your toes. You don't have a chance in the ER. Physicians, I'll talk for them. They don't have a chance to slack off because they're going full speed.
I have to believe coffee supplies, that's why it's gone up, is that you guys are trying to stay up with that. What trends are we seeing with physicians now, also, in addition to the fact that they're just slammed because of the Obamacare? What do you see as...
Well, it's a change in medicine, and it's a change in physicians. We have laborists who basically are in the hospital 24/7 to deal with... or to take care of childbirth and Women's and Children's Center. We have neonatologists who are going to be working 24/7 very shortly, and they deal with the high-risk babies. We have a level 3 NICU that is bursting at the seams, and we're going to expand that as well as the ER. The change for the physician is most physicians work out of their office these days. The medical doctors work from their office, and they let the laborist, the neonatologist, and also the hospitalists. And that's a new concept I'm not sure if everyone is aware of. These are medically trained doctors who basically are in the hospital 24/7 taking care of the patient. And this frees up a physician to be able to be in his office and tend to his patients there, but also to send patients to the hospital that need to.
He's delegating things to various other experts who do what they do.
Right, and it's a much more efficient way to do it, and it's part of the way we're dealing with the changes in medicine coming from Washington.
I have to believe that, as you say, it does keep everyone on their game, and it makes room for more specialties in medicine as things get delegated down the way to other experts. We're going to take a break, but when we come back, we will talk about things, how they may be changing in the future for hospitals and physicians, and again, whatever else we might be covering regarding the Affordable Care Act. We're here with the Providence Holy Cross Hour. We're talking to Dr. Bob Raji. We'll be right back after this break. Don't leave. This is AM 1220 KHTS, your hometown station.